Good afternoon, everyone. Welcome to Senate Education. It is Tuesday, January 11th, 1:33 p.m. The bulk of our time, in fact, most of, if not all of our time, is going to be spent pulling apart and understanding the administration's new guidelines around contact tracing and addressing the needs of students, faculty, school personnel, and families in this era of COVID. So because of people's schedules, in some ways, the order isn't ideal. No offense to you, Mr. Fannin. In some ways, it would have been great to have the agency and Dr. Levine here first. But that being said, I think we'll be fine. We do have a combination of those that usually represent various groups, such as the School Board Association, Sue Siglowski, and others with us, but we also have some people who are on the ground. And for complete transparency, one of whom is a relative of mine, Patrick Pennick, who's the principal, lives up in Craftsbury with my aunt and uncle, and he is the principal of Hardwick Elementary School. And so he will also be here. So with that, Mr. Fannin, why don't we start with you? And if you would, kick us off with talking a little bit about the NEA's response and the concerns that we've read outlined in various news organizations as it relates to the administration's new proposal. Floor is yours.
All righty. Well, thank you very much. Good to be here again. Jeff Fannin, representing Vermont NEA. And happy to talk with you about the changes that we learned of Friday afternoon. I unfortunately was not able to hear the press conference today. I understand through the grapevine or the Twitter vines that there wasn't anything dramatically different than what we heard Friday, I think. But if others heard it and can correct me if I'm wrong, I have not, and I make no compunction about saying so in advance. So you're right, Senator Campion. It would have been nice to hear from Dan French first, and I'd follow him, but that's not the case, and I'll do the best I can. So I would just start by saying, after what was probably, this is certainly the toughest of the 3 years. I think I've said that here previously, the pandemic 3 years, that is. And last week was perhaps the toughest of weeks throughout the pandemic, coming back and the Omicron variant spreading incredibly quickly and stressfully, therefore, in the school system. It was a tough week. And to cap it off with getting an announcement late on Friday that there were changes ahead, I think really hit people in the gut, demoralized them, and frankly, I think people are anxious, a little bit afraid, and that goes for the entire school community. So I think everybody was reacting to that late notice and more process necessarily than actually what was in there. As I understand it from the medical community and hearing Dr. Lee this morning on VPR, contact tracing was unsustainable. It was too and frankly ineffective. I don't argue with the science. I've not heard, other than that one interview, I've not heard more. I do know that the school nurses were overwhelmed with contact tracing. School staff generally were overwhelmed with, those who were doing it were overwhelmed with it. And the speed of Omicron was making it just impossible to continue. So I understand the science and sort of the realities of it. What we have said, and my board said on Saturday, we had a board meeting on Saturday, Vermont NEA Board of Directors, and it's a cross-section of school educators, teachers, support staff, bus drivers, and the like. They thought three things came out of that meeting with Dan French. We had a good hour plus with Dan. It was vigorous conversation, as you might expect. People are concerned, and they expressed that concern to the secretary on Saturday. But the three things that came out of it, we need rapid tests for all students and staff, not just the unvaccinated, as what I saw on Friday from the Agency of Education. We need high quality masks that are distributed at the schools for all staff and students. And I think lastly, we need superintendents at the local level to be able to make decisions based on the health and safety of their school community, to pivot to an environment, either close a school or to a remote environment temporarily, to address the local needs of their school district without penalty and without fear of penalty. And so I think those are the three things that the board, Vermont and EA, thought very importantly needed to get conveyed to the Secretary of Education on Saturday, and I think did. So that's where we are. We think is important to go. There's a lot more to unpack there. I'm curious if there was more to unpack from the press conference today, but that's where we stand. And I'm happy to answer questions. Those are the three big points that we think are important right now. And with that, I'll stop and answer any questions.
Yeah, a quick question. Did you put that in your press release, that those were the three things you were looking for?
Maybe not all three. I'm
okay.
I haven't read the press release since Saturday.
Sure.
Camping,
no,
so
and
I don't remember
the article, and that's so you are comfortable, it sounds like. So these are the three priorities for you and your membership, but it sounds as though you do support what seems to be the science around removing the contact tracing, reworking that. In other words, that it's not sustainable in the schools.
It's not currently sustainable in the schools, as I understand it, as currently set up. Could you create a construct where it would be and could be? Yes, but as things stand today, I think it was not possible to keep going. It does not mean that we don't think testing doesn't have a place, and certainly the rapid tests need to be distributed to everybody in the school community, so that they can test and be sure there's not a. First of all, teachers want to be in the school and teaching.
Sure. Yeah.
There's no doubt about it, but they also want to do it in a safe way, safe for themselves and safe and their families at home, so they don't bring the virus home to a loved one. And certainly they don't want to bring it to school and infect a kid, a student. And so that's just, so the rapid test gives them a sense of comfort and security that I think is really important, and we should acknowledge by making sure they have those kits available to them so they can take a rapid test.
And is that what you mean by the construct? That's the construct that you think when you say it. Well, back to contact tracing. You said contact tracing doesn't work, but it could under a new construct. What does that new construct look like?
Well, I don't know. I've just heard people say we should, hire staff to do that. And I guess, could you do that? Yes, in theory. I don't know that you could do it
if you
this
had
quick.
Staff, right, to do it.
Yeah, I mean, if you had an army of contact tracers, you could do it.
Of course.
In a much more speedy fashion. But what we have now, and the speed with which the Omicron virus apparently is spreading, I think that's the challenge, the practical realities in the school setting today. And that's what I have to be realistic about that. I'd like a lot of different things in the school setting, but I have to deal with what we have now. And that's what we don't have an army of contact tracers.
Yeah. So before you put out this press statement, which I have to say, it took me aback a little bit. I mean, in that I felt as though there weren't specific solutions in there. And I felt as though it was, well, let me ask it this way. It sounded to me as though you were opposed to contact tracing as is going. And so school nurses and others have said, yeah, okay, this isn't working. I guess what I'd like to know is, before putting something like this out in a pandemic, who do you consult? who is a medical professional? Who do you pick up the phone and say, like, do you contact? I mean, we're going to hear from Dr. Lee later. I mean, who is sort of those point people for you that you say, all right, we're going to pick up the phone and talk to these 3 physicians? Or can you just say something about that?
So we don't have a medical person on staff at Vermont and EA. I'll just say that.
No, I understand that, but there are people who consult, like Dr. Lee and others that, do you consult any science or any physicians before putting out something like that?
We didn't consult with a doctor before we put it out. No. Okay. And certainly, that was one of the things we made clear on Friday when the group of us meet with every other week with the Secretary of Education. And again on Saturday was, if it was a medical decision, we were perplexed and did not understand why the medical professionals weren't out front and not the Secretary of Education.
Sure.
So
We'll learn a little bit more about that. I mean, I don't know if, for example, if the rollout was supposed to happen Friday, and I do think what I'm hearing from a lot of folks is, and it might be a little bit of what you're saying also, in general, people didn't like the rollout, but might, if Dr. Levine and others had been out in front, or if this hadn't been leaked to the press or ever how it went, people might be comfortable with it.
I guess we'll never know, because it's impossible to put that toothpaste back in the tube. It was announced as it was late on a Friday after a tough week, and it landed with a thud, and it demoralized, I think educators generally.
Senator Persler.
Thank you. Jeff, when you said without penalty, when talking about pivoting to closing schools or remote learning or something like that, did you mean the penalty being having to add those days onto the end of the school year, or were you talking about some other kind of penalty?
I think that's right. The penalty of having to make them up in theory. I mean, we're not trying to get away from the 175-day requirement. It's just that we're in the middle of a health pandemic, and if health and safety is the priority, and I believe that it should be, and it is, then we need to make some allowances and give school leaders, they know the school system, they know the community better than I do at the state level, or anybody at the state level does, I would argue. And we need to give them the opportunity, without fear of having to make that up later, if it's for the health and safety of the school community, to make the decisions to pivot to remote or pivot to close, whatever the case may be.
Okay, I just want to make sure that's what you're talking about, because I agree. I wouldn't want them to not make the decision worried about such a penalty if that's really the best decision for that school. And I don't want them to be thinking, well, maybe we shouldn't do it because the secretary won't give us the waiver of those days. I agree.
Well, the waiver, the secretary's talked about issuing guidance on the waiver issue come February. Here's what I would say is that we're in the moment right now, and the virus is not waiting for February. The virus and the speed with which it's going through everything is happening right now. So that's why there's a sense of urgency in my voice on that. And it's because it is urgent.
Agreed. Thank you.
Senator Lyons.
I'm trying to remember if we put in place some latitude within the Agency of Education for changes of rules or guidelines during the emergency. I know that in health and welfare, for example, we have what's known as the Regulatory Flexibility Bill, which gives the Agency of Human Services the option of changing licenses or changing regulations around hospitals and so on. And did we do that during the pandemic emergency? And it may be that, I mean, that seems to me that's something that has been missing from the school process, is it all relies on the top-down administrative decision-making for the details. So I don't know if we did that or not. I can't remember.
Well,
and
certainly
Tim isn't here. You're here. So
Well,
You might remember.
when the governor issued a state of emergency, with that comes a great deal of authority, and one of those was to waive regulations.
Yes, but at the level of the Agency of Education, I don't know that I don't know whether the authority was ever utilized. And were there specific recommendations that the legislature might have made or others might have made that would have facilitated this kind of response? I mean, it just seems that we're still in a surge that's going on. And to have that flexibility seems critical.
It looks like Mr. Nichols may have his hand up. Jay, are you saying that you have an answer to this?
Yeah, hi, folks. Jay Nichols for the record, Vermont Principals Association. So what they did do is the State Board of Education gave the secretary authority last year during the emergency to, determine waivers without having to go through the state board to the 175 rule. They've given him that same authority this year. And I think you may want to talk to Secretary French when he's here about how he intends on using that. What he said during the press conference today was, and what he's signaled along has been if schools have to close because of COVID in terms of being able to have enough staff, that he would certainly consider that. But he did not want schools closing if at all possible, and he wanted them to be open to instruction. So I think that'd be worth having a conversation with him. But that is, Senator Lyons, to your question, that's the one authority that was turned over to him vis-a-vis the calendar year and how many days of school.
Thank you. I remember as you're speaking a little bit about that one.
Jeff, did you want to follow up on that at all?
Well, I want to thank my friend Jay for the clarity, but it still does require a superintendent to seek the waiver.
Mm-hmm.
And if it's denied, it's denied. And what Secretary said on Friday, and again, I think on Saturday, is he will be flexible with schools that close because they don't have enough staff or they don't have enough students because of it. But he would not look favorably upon a waiver request that was preemptive in nature. In other words, I anticipate I'm going to have a health crisis tomorrow, so therefore I'm closing, or the next week, or something of that nature. I don't know specifically, but so I think that's the concern we have, is that if you're a superintendent, and there's some here, I think, who might speak to this better than I could, but they need to have that flexibility without fear of having to make up those days, i.e. a penalty, if it's truly for the health and safety of the school community.
Before just going to Senator Chittenden, I'm wondering, what if, for example, school went, 190 days. In other words, there was more time in the class. I mean, one of the things we're going to be talking about today, again, is that social, emotional, the educational losses, trauma, academic losses. If children are in school, technically a little bit longer this year, why is that a bad thing?
Well, I certainly think people need to know that now, and some of the agreements we have.
I understand the timing, but just tell me a little bit about it from where I'm sitting. Again, as kind of a layperson on this, all I keep hearing. I remember Senator Cummings was saying her grandson entered school in kindergarten. He's now in second grade. Kids have lost a lot. We all know that. So what if all of a sudden some school years run a little bit long? Your kids are in school a little bit longer. It's the social emotional piece. It's working on academics. Is that something you're opposed to? Seems like it's good for kids.
I'd have to know. The devil is in the details there. I'd have to know more about the details. Certainly, we think kids are better off in school.
Sure, right.
And if the school year needs to change for whatever reasons, I think we should have those conversations. But
No, and I'm just asking, again, it just seems to me that we're talking about kids possibly, again, being home, maybe unsupervised during summer, again, learning loss. It seems that it might be just, there a little bit, and I was just curious to get your thoughts on it. I mean, yeah, the devil's in the detail. You're right. But I'm not. Yeah, it's either 100. Yeah, you're adding days. Those are the details. Yeah. Okay, Senator Chittenden.
Well, I see Lynn has her hand, and she might be speaking to this point, so I'm fine.
Sure. I hesitate to jump into other witnesses, but Ms. Cota, if you want to say something now, we are going to hear from you, as you know.
Yes, I could wait if you would
Okay.
like.
That'd be great. Thanks. Senator Chittenden.
No, my point's moot.
Okay. Any other questions on this topic? So just to recap, you're hoping that one of the things that happened at the press conference was talking about rapid tests for all, not just the vaccinated, high quality masks, and superintendents having the ability to actually pivot. Those are the 3 takeaways that I have here, Jeff. Is that accurate?
Yes, rapid test for all.
Yeah, rapid
not
test
just
for
the
all.
unvaccinated. Yes.
Yeah. Nothing about contact tracing though. So you don't want to, and that was what it seemed initially on Friday you had big concerns about, but it sounds like the contact tracing thing is not on your agenda.
Well, we have learned, and Dr. Lee did talk about it this morning, as I said. I think understanding the medical science behind it would be good, which is what we said to the secretary on Saturday. If it's a medical decision, the medical professionals need to be out front and making that announcement.
Okay.
And they were not. And so we're all left with, no, we're not going to do contact tracing.
Right.
Why not? It gave people a sense of comfort and security that they weren't bringing the virus into school, and that if it was, we knew who had it. Yeah. And it gave people a sense of comfort. If we're going to remove that one layer of mitigation, are we going to replace it? And if not, why not? And I think the answer on that, I'm guessing, is that it medically is not effective anymore.
Right.
And then if so, what are other things that we're going to put in place or redouble our efforts on to make up for it? And one of those, I think, is the 3 that we're talking about is, and certainly the 2 mitigation factors are better masks for all, and more accessible, and more rapid tests for everybody to make sure they don't bring the virus to the school or to their home.
Okay. So I'm not going to add, in terms of the NEA's position rate, I'm not going to add contact tracing. We're talking about those 3 things. Those are your priorities. It's important to clarify this.
Yes.
Yes. Okay, great. That's really helpful. Thank you. Other questions for Mr. Fannin before we shift to other questions for him related to workforce? Okay. Great. So one of the things we asked you to look into a little bit was the shortage out there with teachers, with staff, with other personnel. And I know Senator Perchlik raised the question about how sometimes teacher certification can be expedited, how there can be some of the training that you all do. Can you kind of bring us back and tell us what you've learned over the past week or so?
Sure.
Is there a role for us to help with that?
Well, I would say at this point, I'm not sure that there is.
Okay.
Just to be very honest, I'm not saying there won't be in the future, but I think a couple of points I think are important. We do think that there's, and this might be with VSAC, that's why I say I'm not sure this is the legislature, but certainly loan forgiveness ought to be a top priority. Grants for future educators, especially BIPOC students, making it those who, grants are different than loan forgiveness. Having been a recipient of both in my earlier life, they both work very differently and help in different ways. And so we should explore both of those at a minimum. As well, I mentioned it last week, and again, we do work very closely. Our professional director, Julie Longchamp, does work closely with Castle and Rick Reardon there. We do a lot of work with them. And, is that, I'm not saying that is the one, but, maybe we have a hub at a state college that focuses on teacher preparation. So
Right.
those
Yeah.
are.
So you were going to come back, you were going to talk to Julie, and you were going to outline, give us just some numbers in terms of how long it usually takes and whether or not, there's some work here for us to reach out to VSAC. We know that there's a huge shortage of teachers. We're heading that way. I know you were going to also touch base with the treasurer's office and see how many teachers we've lost this year. And we're trying to put some things in place to help with the substitution issue, substitute teacher, as well as get good people in the classroom who want to be good teachers who are interested in it. But knowing that we're in a pandemic, are there ways again to expedite this process? I know the one state that has really expedited it has been Michigan, which I know probably isn't on the face of it. We'll see how it goes, but they've, as I'm sure you're following with your membership, they've taken some steps to get as many people in the classroom as possible. So just trying to get a sense from you where things are and what we can do.
So I did speak with the treasurer's office. It's still looking at the numbers a little bit, but they are in 2019, which is, I'm going to count that as pre-pandemic, there were 374 total retirees.
Okay.
In 2020, there were 486.
Wow.
And this last year, 2021, there were 445. Now, I think that that's just but a snapshot. There may be other factors, not just the pandemic. And I think that is worthy of further discussion to understand those numbers. Those are the raw numbers. I don't know what, the significance of them. They're up.
Yep.
But there were other factors in play too, not just the pandemic, not just, we have a teacher shortage generally, obviously, but we do have a pandemic, and there was also concerns about teachers' pensions last year.
Right.
And so people may have made decisions based on that. I don't know, and I don't know that the treasurer's office has any way of identifying who left early, or people make decisions based on a lot of reasons. But those are the raw numbers, and that's what they explain.
Right. Yeah, it seems like a jump. It seems that so you don't have at this point any numbers in terms of how long it might take people to get through the process to become certified right now, sort of under the expedited model that Senator Perschlick mentioned.
Can you say that again? I'm sorry, I'm not sure.
Yeah,
I
I'm going to
understood the
let
question.
Senator Perschlick clarify, because I'm probably not articulating it that well. Senator Perschlick.
Thank you, Chair. The thing that I was talking about was the peer review process, which is kind of an alternate route to get your licensure if you have work experience or other experience that would help you to get the license if you didn't go through a regular teacher licensing program. And after our discussion, because we asked you, Mr. Fannin, about that, but I'm not sure. I was wondering if what you were talking about last time you were with us was something else, because when you said we, I didn't know if you meant the NEA or we, the state, because my understanding the peer review process is run by AOE, but maybe, so I don't know if there's something else you were talking about, if you remember, but what I was talking about is the peer review process. And I went back, and I was kind of critical of it last time we talked, but I talked to some of the teachers that have gone through it, but they complained about the time it took, but they were always getting waivers to teach. So they were able to teach while they were going through the process. But the people that were most critical were early child educators, because you need a license holder to be participating in the universal pre-K program. So if you don't get your license, you can't participate at all. And trying to find licensed folks to work in a childcare is hard, and they're having a hard time going through the peer review process in particular. So that was my question last time. So I don't know if that helps you.
Yeah, it does. So we do have a year-long support, a class through our professional program for peer review. So that's something we do. It just
go through. You're helping folks to go through the process.
Correct. So we support them, and I think we have close to 30 people in that program now. They're typically on a provisional license, so they get a license, a temporary provisional, and then we help them develop a plan to get their regular license, and so we work with them to do that. So that's something we do currently.
And I assume you don't do it for early ed because they're not part of the unions, unless they're in school.
Yeah, there are a few schools that have it, and we think that's certainly the right place to have it in some respects. That's a different conversation, but it's not as if we don't. I don't know all of the categories of teachers that we have in our peer review program.
Okay.
You know, it's a year-long process. We want to give them the support. The school needs to give them the support to and give them the flexibility to get to these meetings and do the things that they need to do. And so we try to support them as much as possible to make sure they accomplish it. That's our goal.
Right. Okay. Well, I think, Mr. Chair, maybe my question is more to AOE about the data I was looking for, like how many people go through it and what's the average time it takes them to get it, and what's the success rate?
I mean, for us right now, we have 28 people in our program. It's a year-long effort. Does it continue on perhaps afterwards? Perhaps, but it's initially, at first blush, it's a year-long effort.
Right, for the class. But I think that, I mean, from my understanding, anecdotally, it takes longer to get the license through the peer review program, but I'll look into it. Thank you.
Okay, we can have AOE and to talk a little bit about this as well as some of their ideas to get the teachers that we need in the classroom. I think the final thing, Jeff, you were going to bring was a draft of a loan forgiveness policy for teachers. Again, we were feeling, this is one of the things that we know that there's a teacher shortage. We know looks like it's going to get worse. What would that loan forgiveness policy look like?
I'm going to take a half step back, if you will. I'm just getting word that I think there are some 300 people in peer review statewide, Senator Perchlik. But the AO would probably have a better number, but so that may be something an AOE could address. As a loan forgiveness, I think that's we think it's advisable, right? I mean, I think that the teacher shortage predates the pandemic.
Yep.
Why is it that teachers aren't? Why isn't a larger group of students in college looking to go into education?
Yeah.
Certainly, they've grown. The students in college today have grown up under what I would call the test and punish regime under No Child Left Behind, and we need to figure out a way to return to the joy of teaching, and not just testing and punishing schools for in that regime. So I think that we need to figure out why it is the school climate is not attracting more students, young students, I'll say, aspiring educators into the profession. And certainly salary is one issue, just to be clear, and as well as school climate, their work environment.
Yeah.
And both need to improve to attract the best and brightest into the classroom to teach. And I think both are important. It's not, teachers need to be compensated and compensated well, but they also need a healthy work environment in which to teach and support. And we need to make sure that administrators have that support, principals and teachers and support staff who want to come in, that they're not feeling demoralized every day. So
I think it's a great point. And I think what we were looking for last week when we talked to you, just to kind of get us started, maybe you can give it some more thought. What might this look like? This is a moment where we need more teachers. We know schools have particular resources out there. The legislation. Go ahead.
The one thing I would say is that, working in private industry as they did years ago, it's always less expensive to retain somebody or retain a customer, if you will, than get a new customer, or retain to attract a new employee. And so the priority for us is retention, truly. And one way we could do that is incent behavior this spring to get more teachers and more support staff to stay through next school year. So perhaps a retention bonus at the state level to retain people and not have them retire, as the numbers indicated. Instead, have them teach another year, work another year in the classroom, drive another school bus for another year. Those are the things that people need. They need to feel appreciated, and I think that would be helpful in the moment, certainly the COVID moment, but also it would. I believe it would help people think that they are supported.
Great. Yeah, I'm inclined to agree, and would appreciate your thinking around this. Honestly, I think nurses right now in particular, we're hearing with these lines and these incredible pressures on them, and certainly all different school personnel.
There are many forms that a loan forgiveness program could take.
Yeah.
I think we should work with VSAC on that. Mm-hmm. They have the knowledge, the expertise, but some reduction for years worked, and certainly grants for aspiring educators, and with a focus on BIPOC students. Yeah. We need more teachers of color in the classroom to teach students of color.
Would you reach out to VSAC and do some of that
Sure.
work? That would be great. And then we'll have you come back next week and just talk to us about this, because it is pressing and it's related to the pandemic. And we can take some testimony, and I'll talk with appropriations around the other pieces. But that would be very helpful. I think I just have one final question, and I'll to Senator Persley. Back to the three areas. The recommendations. When we have Secretary French in, this is related to COVID, did he bring up, or did he not bring up, when he was in a meeting with you, that Dr. Levine supported this? Did he even mention that there was, this was based in science, or was this during that meeting that, again, was that not shared?
I can't remember if he specifically said Dr. Levine, or the medical community in general. I think, but certainly,
I want to something we want to ask him too. I mean, and so you're saying he did bring that up. He did say
what the Secretary of Education said was it was a medical decision, right? It was based on the medical science, and we respect that, and we don't argue with it. Right. What we said was, then why wasn't that the lead? Why wasn't the medical community out front saying this is why we're changing this? That was not the case, and so that's maybe that's just a messaging issue, and that's fair.
Yeah, it might be, and this, I'm speaking just for myself, but in a pandemic, I would love to see us all working together as much as possible. And it seems to me, again, from where I'm sitting, picking up the phone before putting out a press release and just checking in on that and saying, hey, can we have a quick conversation with Dr. Levine? Can we, it just seems to me, Jeff, to have been again, my opinion, the right thing to do. I think Vermonters deserve right now all of us working together as closely as possible. I understand that the press release piece wasn't ideal in the rollout, but I would also say the response, two wrongs don't make a right. The response could have been, we're going to talk to Dr. Levine. We're going to touch base with a half dozen medical professionals before we put this out. So I think the way you guys rolled things out also was not ideal, again, from where I'm sitting.
Fair enough. It was a statement by the board that I stand by. They're my board.
Sure, I know, I understand.
And the announcement on Friday was demoralizing, and people were frustrated and angry, and we needed to, I think, rightfully express that frustration.
Senator Pershler.
Thank you. The other thing we talked about on workforce development, change subject back to that, was might be called the Nichols language around retiree teachers. I didn't know if he had spoken, he brought that up last year too, but I don't know if I've ever heard of NEA, just what their position is on that. Is there an issue with you guys on
It's
teachers?
It's an evolving conversation. Certainly the pensions were the focus, and this took a little bit of a backseat, I'll be honest with you, but the idea of getting a teacher who's retired back into the classroom for a limited period of time where it doesn't harm the pension system, because that was one of the concerns we had, I think is a valid one. So I think if I understand correctly, the proposal, yes, we do support it.
Okay, great. Thanks.
Senator Hooker.
I think Senator Lyons had her hand up first.
Sorry.
No, that's okay. I have a comment that I was going to make, but I don't need to make it right now.
Okay.
It is concerning what we're hearing about the result of this instant announcement. So I'll say what I was going to say. The virus can mutate in a minute, can turn on a dime, but people and organizations do not. And it sounds like the announcement on Friday was asking for a large group of people to turn on a dime. And I feel that's very unfortunate.
And especially, thank you, Senator Lyons. I think especially after a really tough week. And I understand it was tough for the school nurses and those who are doing the contact tracing. I understand that, and I appreciate that. So it was, as I said earlier, it was demoralizing. It was a tough week.
Senator Hooker.
Thank you. Jeff, I want to go back to your idea of a teacher instructing hub and ask if there's been any conversation. You talked about your person working with Castleton a lot. And this, I think I mentioned before that I think that this is a really opportune time as we're talking about mergers in the Vermont State College system to bring that up. And, Castleton was Castleton's Teachers College in the past. And I'm just curious to know if there's been any attempt at reaching out about that possibility.
We do work regularly with Castleton, but not in this regard about making them a hub. No, it's a worthy conversation. It's a long term. I mean, certainly the retirement bill that just asked about is a temporary solution. What we're talking about is temporary as well as long term. And I think certainly working with Castleton or one of the other state universities, however we want to do it, to make that institution a hub for educating teachers, we'd certainly be willing to work with Castleton or whatever comes of, what other state university. So we would support that. Certainly willing to do it. It's a long-term endeavor, though. It's not going to.
I understand the long term of the whole process, but I think my feeling is that since the merger is happening and that's in the process now, it might be a good idea to plant that seed.
So, for example, the peer review class right now is through Castleton. So we do a lot of work with them, and that may be a ready-made relationship.
Thanks.
Any other questions for Mr. Fannin before we move on to Ms. Coda? Seeing none. Thanks very much, Jeff. Looking forward to seeing you again soon, I think later this week. And we'll leave it there.
Thank you all.
Thank you. Ms. Coda, thanks for being with us. We really appreciate it. You've been with us now for the past, I don't know, hour or 45 minutes, so you know the topic. I'd say it's twofold. One, tell us a little bit about your needs right now, what you're seeing on the ground. I think that's first and foremost, particularly as it relates to what the administration is now rolling out. And then, if you have a couple of minutes after that, we would also be interested in just, and I'd say related, long-term needs, long-term issues. One of the things that was raised in committee last week is that you and your staff and faculty have your eyes on trauma and how students are responding to this. So if you would take 10 minutes and just kick it off by saying how things are going and letting us know how we can be helpful, that would be great.
Okay. Well, I appreciate having the opportunity to speak with you all today, both about the mental health challenges that we're facing in our schools and the changes and the reality that we faced last week. I think it was helpful to listen to the first half of your meeting today. I'll start with just responding to the COVID protocols. In terms of Secretary French's announcement on Friday, I know we as superintendents certainly appreciated having that advance notice. Because schools really need that when it comes to changing guidelines. Without that notice, our systems really struggle to contend with how to interpret in real time as our stakeholders are reading the guidance and listening to press releases and misinterpreting what it actually means. I think that we have seen heightened anxiety, and I think that without that advance notice, it really kind of hamstrings us when it comes to turning communication around effectively. Unfortunately, I think when the notice to school superintendents is followed immediately by a media announcement, it doesn't actually give us the ability to analyze and to interpret and to communicate effectively. I think the interpretation of Friday's announcements was that schools were going to stop contact tracing and testing. And I think that in reality, it means something pretty different. I think that today's press conference really helped to clear that up. I hope people were listening today. I think what it really means is we're not going to stop contact tracing. We're just going to respond differently when we have positive cases in our school. So instead of our nurses and our leaders spending time looking at seating charts and bus lists and interviewing staff and students about something that might have happened 5 days ago, which in the construct of Omicron, it's no longer effective at all. It's far too distant from when we need the information, and it's definitely not sustainable. So I think that the intention really is not to stop contact tracing, but changing that definition so more people are actually finding out that they might have had an exposure, not necessarily that they were within 6 feet for more than 15 minutes. The other piece around the testing is I also think that people have interpreted that to be that schools are abandoning testing. And I think it's that they're moving away from PCR because it takes too long for those PCR tests to come back in favor of more of the rapid antigen tests. So I think that, one of the things I heard before I came onto this meeting in the press conference is that this really means broader testing availability for our staff and for our students. We won't have to rely specifically on school close contacts anymore. It's going to be exposures both in school and out of school, and availability for both vaccinated and unvaccinated individuals. So I think Senator Lyons made a comment earlier that spoke to me, and she talked about the systems having to pivot on a dime. And I think that that is certainly something that we have communicated to Secretary French throughout the pandemic, is when the information gets shared in real time with our communities, and it results in us having to figure out our process and our how we're going to respond to these changes. Our systems just don't turn that way. It takes us more time to really dig in and figure out what this means. So I appreciate that advanced guidance. It's unfortunate it kind of landed the way it did. Looking forward to having some really clear written guidance. I'm hoping that's coming in terms of how to implement the new programs that are kind of replacing the things that we had previously. So I think that, that really clear communication to our communities will be helpful, especially if we can get it ahead, because that interpretation then gets done by the media and by social media too. And I think that we all just saw evidence of that over the weekend. So it's my response about the COVID reality right now. I certainly could give you more information about what's happening on the ground. I suspect you have already heard that from some of my colleagues in the last week.
Questions for Ms. Cota? I think one that jumps out to me at this point is we've talked a little bit about the waiver process and how superintendents submit a waiver around going remote. Can you just tell us something, and I'm sorry if I missed, I had to step out for a minute. What does that waiver process look like? I mean, is this 5 to 7 pages, or is this just some quick information that you put on a piece of paper or an email?
I can tell you what it looked like last year. I did have a period of time last year where I had to close schools. We were able to shift to remote pretty quickly, and that was a simple communication with Secretary French, and he approved the waiver that we needed for one school day. I think there's some difference in terms of what it means from a regulatory standpoint, in terms of attendance, and whether or not we don't necessarily have the ability to just shift to remote. It's either our schools are open or our schools are closed at this point. So what we're hearing from Secretary French is that we will have some more information about the details of whatever process there is in place this year to request that waiver. I don't expect it's going to be complex. I think that both Jay Nichols and Jeff Fannin spoke accurately about it. I think that Secretary French has stated he'll be very sympathetic to us having to close in response to the pandemic, but not preemptively to worries about the pandemic.
Other questions for Ms. Cota? So the other thing that was mentioned during the earlier testimony was, what do we do with school days? What sorts of things should we be doing around counting, not counting school days? And one of the things I know some folks have said, well, I think we've heard this over and over again, when children are in school, it is going to impact their learning. It's going to negatively impact their social emotional growth. So we have not heard from the Secretary yet on this. We will this afternoon, but are you hoping that remote learning does count toward those 175 days, or is that something that you could see us saying, okay, school needs to really go 180 days in order, because, such and such school closed for 5 days, and, kids deserve a full 175. Can you say something about that?
Yeah, my gut reaction is I hope you don't add days I think
Okay.
that the reality is we're really going to struggle to even get to the minimum 175. I think throughout the state, we're already seeing it. We're seeing many people having to close because they have those staffing shortages.
Yep.
I think what we don't have right now is the flexibility when we get in those places to make a shift to remote learning and have it count as a school day, because I do think there are some lessons learned over the last 2 school years, and our teachers are pretty prepared to be able to shift to offer some instruction and learning when we do have to not be physically present in our schools because of the pandemic circumstances. It gets very tricky when it comes to staffing both in and out of school, because there certainly impacts. You can't really put a substitute teacher into a remote learning classroom.
Yeah.
Other than that, we do have some benefits that we could use, some tools in our toolkit that we're not utilizing right now.
Yeah, and also I'd say it's incumbent upon all of us to make sure that there would be the legislature funding for after-school programs, summer programs, things like that, where some of that educational, academic loss, social emotional loss can be made up for. And that was something that we worked on last year and would plan on working again on this year. Senator Chittenden.
Lynn, thank you for your testimony. I just consulted with my public school consultant, my lovely wife, Kimberly, and she was also raising something that's come up in previous discussion that I'd love to get your reaction to. I understand SBAC testing usually can take 1 to 2 weeks of time. That's time that's lost to instruction. It's time later February, sometimes March and April, when faculty or teachers are not teaching, but instead just testing. My question to you is, as I understand the teaching landscape, what's your reaction to, instead of extending into the summer, if schools have to go remote or so on, we press or we advocate for the waiver of those testing requirements, as was done in, I think, 2020 because of the pandemic, in order to focus on instructing the kids and to carve back, to give back those instruction days and moving away from testing just during these crisis times of the Omicron variant?
I certainly wouldn't be opposed to requesting the waiver. I think it's certainly a federal level waiver request, and it's something that, the way I understand it last year, wasn't something that was available to us to even request. So I'm not sure, even though it's a great idea, it would be something that the federal government would allow us to do. I am going to, when I talk to you about mental health, I am going to address that a little bit in my testimony there.
Thank you.
You're welcome.
Senator Lyons.
Thank you. And Superintendent Coda, it's great to see you.
It's good to see you.
Okay, so I do have a question going back to remote. What's the concern about not counting remote days? I mean, is it the accountability, the measurement, looking at how much time kids are actually in instruction, and the outcomes measurement? What is actually the issue around not counting from your perspective?
I think from my perspective, if we choose, instead of closing, to shift our schools to remote learning, and then we find that day won't count for us, we're going to have to make that day up at the end of the year, and we will have used our staff, who we are contractually obligated to have them work the 186 days or however many days are in their master agreement. They will have already worked the day, and then we'll have another day that we have to add on top of that, without the staffing structure that we can rely upon for those days. So that's one of the barriers that comes to my mind, is that uncertainty of whether or not it would count makes it really tricky to plan for the end of the year.
So this is a question that we'll be also be asking the secretary to get his perspective. So, yeah, thank you. Thanks for that. I have another question, and that is, we spent some time last week talking with the Department of Health and the Agency of Education about communication. And it sounds to me like all that time, I won't say it was wasted because it was great, but it seems to me that there must be a protocol or a process that you folks could recommend that would sort of mitigate or obviate the events of last weekend. We don't need to keep putting fires out in this world. We've got enough going on.
Yeah, I think that we've made it really clear throughout this process that the timing of communication is really essential in order for us to begin to take our systems into whatever turn is ahead for us. I do think Secretary French was attempting to give us that advance notice on Friday, and I very much appreciate that, because I think if we had had the opportunity to think through over the weekend how we could relay this to our community in a way that was digestible and could have helped them from reacting in the way that they did, we could have had a different Monday, I think, a different reality. So I think there are attempts. I think the tricky part is when they make attempts to communicate to the field, sometimes it still goes out at the same time to the rest of the stakeholders. So I think if there's a way we can think about a process that gives us the information in real time, that helps us to plan much more effectively.
Yes, I mean, it's good organizational management to have that type of planning. I have one last question. Oh, I could ask a lot of questions, but I'm going to ask a question of you later on when you're talking about mental health issues. But, you know, if we're thinking about school days and we might be limiting the number of school days, or the remote might count, you know, and we're all sort of concerned about the testing environment. What are your folks doing in your schools around outcomes measurements for kids to determine that they're being successful? And because this is a tough time, let's face it, and some of the measurements for success may not be 4 + 4 = 8. So,
right.
Yeah.
I think that we need to look at outcomes not only through the academic lens, but we also need to look at it through the social, emotional, mental health lens as well for our students. And I think that there's a temptation to really push through and focus on accelerating academic progress for our students. And although that's incredibly important, it isn't realistic in the moment that we're in right now, where on any given day, a teacher could have these 15 students in their classroom, and then for the next 5 days, they have a different 8 kids in their classroom. They're just the students' availability to be in school and to be able to access the learning has been just so unstable throughout this surge. I think that it's challenging to really focus on that. I think that, you know, our schools are definitely looking at it through the lens of how can we be using the real-time data that we have, more of the formative assessment measures to respond to the individual needs of the students. And then also really looking at it through the lens of the whole child, and how can we assess where they are in terms of their mental health, and what kinds of strategies and what kinds of instruction and intervention do they need on that social emotional side of the continuum as well. So we're really trying to look at holistically and not focus solely on the academic component.
Is that something that is respected and approved of by the Agency of Education? Or is it something that needs a change for this period of time?
In terms of mandating,
well, you know, ordinarily you have standards that you're meeting, you know, curricular standards and so on. Does this put a new layer in, or is it a replacement for some of the curricular standards that have traditionally been measured?
I don't think it necessarily replaces. I think what it's forcing us to do is really narrow our focus into what are the most essential standards that all students need to know and understand when they leave us. And I think that, you know, that's been something we've been trying to do for decades in education. But right now, in this moment, it's really forcing us to get there. And it's forcing us to use what we know about those most essential standards to target any instruction and intervention that we're doing with those students, because there is so much movement in and out.
Well, this would be a great conversation. And Mr. Chair, I don't want to hold us up, but honestly, it may be that during the period of time where schools are still in flux in terms of student attendance and so on, and the pandemic or the surge, that maybe the standards need to be modified. And it'll be interesting to see what happens in the future when you have kids achieving some social and emotional stability as compared with memorizing the latest Latin phrase. So,
Right.
yeah.
Yep. No, I appreciate that. And Ms. Cota, we are going to have you, if you can stick around, great, but we do have Dr. Levine and Secretary French coming at 3:30. So I want to get to our other witnesses before then, but we know that you're have a real wealth of knowledge on these topics, and but we're going to have to leave it for now right there. So if you have the time, click back in or stay with us, but we also know you're incredibly busy.
All right, thank you.
Ms. Boudreau, Ms. Abbott, great to see both of you. You've joined us now for a little bit, but in particular, we asked you to come in to kind of continue the conversation that we're on right now as it relates to social and emotional health in schools, what you're seeing and some of the things that we can do to be helpful. The other overarching theme that we've been talking about, of course, that I think you may or may not want to weigh in on are these new recommendations that are coming out, that have come out from the Department of Health and the Agency of Education. But I believe your respective advocacy groups, Superintendent Association and NEA, are weighing in on those. But first and foremost, would love to hear where things are at and how we can be helpful. So with that, you have the floor.
Thank you for having us. So I'm Laura Boudreau. I'm the Assistant Superintendent of the SVSU in Bennington County.
I'm Dr. Kate Abbott. I'm the Interim Director for Student Services in the SVSU.
So thank you for having us. And again, the first part of the prompt was around just if we could briefly weigh in on the updated protocols. And so what we did is we reached out to our famous COVID-19 coordinator, who is one of our very famous school nurses who we're super proud of. And so, I have just a short statement to read, and then
Great.
Dr. Abbott and I would just like to move into the mental health piece, if that's
Terrific.
okay.
Absolutely.
Great. So currently, so this was again created by with input from our COVID-19 coordinator and reviewed by our district team before I shared this. So currently being a school nurse today means sacrificing time after hours on weekends and holidays to contact trace, answer parent and staff emails and questions, implement and communicate updated COVID-19 updates while still acting as a liaison between the learner, their medical home, and the community, completing and submitting state required reports, case managing medical 504 plans, and supporting the medical needs of students on IEPs, implementing vision and hearing screenings, and supporting the day-to-day medical needs of families and learners, who many see their school nurse as a daily support. School nurses are an integral part of our school system and are incredibly important as we continue to maneuver this period of time. Contact tracing is the state outlined process to identify those who are determined to be exposed to a positive person. The understanding is not that COVID-19 protocols, including contact tracing, are ending. There is a change in how the process is going to be completed to reflect the current knowledge of the strain of the virus. As new information is released from the Agency of Education, the information is reviewed and communicated in a timely fashion to our key stakeholders, which are our families, our staff, and community. We are dependent on clear communication from the state and their assessment of the school system's capacity to support implementation to make sure we're supporting all staff, families, and learners. So that was in response to the initial response. And if it's okay, we'd like to jump into the health and wellness piece.
Yeah,
so
we do. And just, we'll have you until about 3 o'clock. So that should.
Oh, beautiful.
Yeah,
Great.
perfect. Great.
Thank you. So just to give you a little context, Dr. Abbott and I co-chair our SVSU Health Leadership Team, which consists of a lead clinician, a lead counselor. We now have a lead behavior interventionist and our lead nurse. And we meet about every 2 to 3 weeks, more frequently as needed. And so just so you have context, that the conversation you've asked us to speak about is something we talk about all the time. To provide a little bit more context, we felt supported by the Agency of Education's message, especially last year, that social emotional mental health should be our priority. And so last year during the pandemic, we tried to restate that message frequently to our families and to our staff, and we tried to provide resources and also collect feedback from them as how we could be more supportive. This year, that theme has continued as we were required to create a recovery plan. And the first pillar, and we call it our first pillar of recovery, is social emotional health and well-being. And so there's a couple of, I entered a document that we've shared with our SVSU school board. And if it's okay, I'm going to share my screen in just a moment. Is that still okay, Brian?
Absolutely.
Thank you so much. So why don't I just go do that right now and I'll take you through. So we made a presentation to our board last month because our community wants an update. They want to know what's happening, and we want the focus to stay on social emotional health and well-being, because that is, we have to make sure that everyone from staff, students, families, and community members are feeling safe and secure right now. Okay, so share my screen. Okay. So can everyone see my screen?
Yes.
Awesome, thank you so much. So some acronyms that I know most of you are familiar with, but ESSER, you'll hear us refer to that, which is our elementary and secondary school emergency relief. MTSS is our multi-tiered systems of support. CIP is our continuous improvement plan. And PBIS is our positive behavior intervention and supports reference. We make sure to try to keep our community updated as to our plans linked to recovery. And so we have access to that on our SVSU website. We are grounded in the Vermont transferable skills. And I think this period of time has been a great reminder for us that these are the critical skills that we want to make sure that our students and that our learners have, and are very much linked to health and wellness. I am also the homeless liaison for our district. And right now our school boards are craving little pieces of data because they want to know and they want to be able to be supportive. So I was able to give an analogy that during the whole school year last year, just as an example, at the elementary level, I did 18 homeless intakes. And between August and December, I've already done 26 this year. And then I've given you a little bit of data around our secondary level. So we've seen in our community an uptick in our homeless numbers. And so that's just a little snippet. Some other data that we collect that we think is super important to make sure that schools have access to is, I love the fact that in the state of Vermont, we embrace a multi-tiered system of support, meaning we want to make sure that we're focused on the whole child. We're focused on behavior, social, emotional learning, and academics. And so we collect screening data for social emotional learning, and starting back this year, we are starting to do our first catch. It's the first piece of data that we've really tried to collect on all of our students so that we know how to support them with resources. So we also have worked to make sure that our teachers and our families have resources available to provide instruction. So you'll notice, for example, Second Step is a resource that teachers can use to teach social emotional skills to students. And we're using grant money right now. to support that, to make sure that everybody has access to these resources. You can see some other references to resources there, and you'll notice in parentheses that we're dependent on grant money to make sure that the social emotional resources, instructional resources are available. If I keep moving on, the next important thing that we want to highlight is the real focus on professional learning for our staff. So we've seen an uptick in students coming out of during the pandemic, even prior to the pandemic. Did you want to speak to that? Even prior to the pandemic.
That have learning needs related to social emotional health and well-being and their mental health. And so one of our needs in our needs assessment during our recovery planning stage, we really focused on counseling and mental health supports and behavioral supports for our learners in K-12. So last year as a school system, we had one board certified behavioral analyst who is kind of like a clinical level behavioral support person. And this year we have 4, and they're all busy.
So, and I think part of what we want to point out as you look at some of these resources, prior to the pandemic, we had behavior, social, emotional needs. They grew last year, and now we have a great need that we know we're going to see moving forward for a long period of time. And so professionally, and we'll show you the staffing piece in a minute, but we also want to highlight there's a need to make sure that our staff are appropriately trained and they have the resources they need to feel successful as they're supporting children. So again, you can notice the trainings that we're working on offering. We're always looking for providers and can always use support in doing that. But you can also then see that we're super dependent on grant money to fund these opportunities. And then I'm going to move into just the staffing piece and give you some snippets. So I'm showing you 2 of our elementary schools in our school district, Bennington Elementary School and Molly Stark. And then I just want you to get we want to give you kind of an overview of the staffing pattern that we know we need to have in place to see the mental health, to support the mental health needs that we're seeing. You'll notice school-based clinician contracted service.
So we partner with our designated agency, which is United Counseling Service, to
I'm
make
sorry to interrupt, Laura, just quickly clarification. So all of these positions right now are filled, or do you have openings?
Oh, we have openings, and where you see contracted service, that means we might have had an opening and we've had to go to an outside agency to help us fund. So
Yep.
there is a huge need to, so some of these are absolutely filled, but we always have openings.
Yep.
There's a huge need. So we just wanted to give you a little snippet of, we now know we have to have a clinician on site. We need guidance counselors, nurses, social workers to help triage between school and family. There again, you see the board certified behavior analyst. We're piloting pre-KK social emotional coaches that can be embedded in kindergarten classes. We've seen a great need in our youngest children needing support, many of which haven't been in school in 1.5 years. So that's been so coming to school, we've needed to make sure that schools have the resources they need to support the needs they're seeing in children. And so I think the important things that we've been thinking about is the importance of we need to make sure that this staffing is able to continue over a period of time. Again, we're really dependent on grant funding. We also know that there's a shortage. I know when there's a shortage of people to fill a lot of the roles that we now currently need to support schools. So we're always thinking about how can we encourage people to go into some of the positions that we listed, and what is what does higher ed look like in supporting these roles? How can we entice people to come to our state? We've also are trying to build partnerships with our local mental health agency to support this work as well. Because here's what we know, and I heard this a few minutes ago, the foundation is behavior and social emotional learning. And when we have that in place and we know that our learners are feeling safe and supported, learning can happen. And so we just wanted to give you a little snippet. Did you want to add anything on that?
Yeah, and that real time, that real time support for teachers when they're facing children that are having mental health difficulties or behavioral difficulties, those on boots on the ground, behavioral interventionists and social workers and counselors, we're going to need that for quite some time. And if we don't provide those supports, we're going to suffer in the long run. So if the grant funding ends, we will need to figure out how to support those needs another way. But supporting those through the grant funding is critical right now, and we're going to have a longer haul than just 1 or 2 years to come out of this for our learners.
I appreciate hearing that. I think we don't hear it enough, that this is, if the pandemic were to end today, it's not as though next year it's going to be business as usual. I mean, this is a many year conversation, 8-year-olds to the point when they're 18 and, perhaps beyond. So how can we start to, adjust our thinking that way? The other thing I just love an update on, last year we heard about a lot of students, throughout the state, families that had really kind of disappeared, when people were remote, completely disappeared. Do you feel now, just one, and we hadn't touched base with the two of you about it last year, I don't recall, but do you have a handle on those students, or are there still students and families that it's these unique circumstances are providing, really unique situations and problems?
So, yeah, so I think, it's a great question. So we've added family engagement specialists to help with that.
Okay.
Number one. So part of our ESSER, we heard this loud and clear. What you've suggested is also what we heard when we surveyed our community last year, and our staff. And so some of it too was so yes, we need to find ways to locate families, and then we need to be really diagnostic about why we've reached this point. And so diagnostic is the key. So we've now, what we're attempting to do is we've created a role. We have 4 family engagement specialists, which we're using ESSER money to support. And we're using them to meet families where they're at, and to be the liaison between the school and home, to really get at the root of what do we need to do to get and to find. And so you are correct. Making sure that we have good supports in place to make sure that we know where everybody is important.
Yeah, and those family engagement specialists have been able to meet families wherever they are. If they're in a transient living situation, to help get their children enrolled, to help them link up to their care for pediatrician care and vision screenings for their kids, and making sure we know where they are and they can access school.
Well, and I guess before I pass to Senator Hooker, also appreciate it. Senator Lyons emphasized it a little while ago, and that is, and I think Ms. Cota did, unless we have that social emotional foundation, Latin, math, reading, writing, it's just not going to happen. So I really appreciate you bringing that back to the forefront for us. Senator Hooker.
Thank you. And thank you both for your work. I can imagine how intense it's been over the past couple of years. I'm curious to know the difference between social emotional coaches and counselors.
Social emotional coaches and counselors. So I'm going to let you take on. Let me do the social emotional coach. So we have one district behavior social emotional coach. And we're a district with 10, we're a large district with 10, schools, and she can support classroom teachers in instruction for social emotional learning. So that's her role. A guidance counselor or a clinician, I'll let you take that one.
So then we have 2 more layers, so that there's the coach, that's the support to the teachers to help the really rich social emotional learning that happens in all the classrooms. And then once there's a child that might be having a hard time engaging in school for whatever reason, our schools have guidance counselors that might be able to address like a transient need, that just someone to touch base with, making sure that you're able to access school. And then our schools also have clinicians who are either licensed mental health social workers or licensed clinical counselors. And those individuals are either contracted or hired, and they're really for the long-standing mental health diagnoses that relate to the child's functioning both at home and at school. But we can provide some of those supports for children whose mental health needs have to be addressed at school in order for them to learn. So we have 3 kind of tiers of interventions for all children, which is our coaching and our instruction in social emotional skills. And then all children access guidance counselors as needed. And then a handful of children will need also the clinical counseling model at school as well.
Okay, thank you.
Any other questions? You know, we continue to realize that you know, all of you are really, you talk about the front lines being the hospitals, but our schools are right there, you know. And so thank you for everything you're doing. We'll look forward to having you back as we continue to delve into this. But the reason I asked Ms. Boudreau to come up was because she had reported to a number of legislators, again, I'll say it again, without that social emotional piece, basically the message was, listen, Brian, you can do all these other things, but that has to happen. And there's a lot of need out there. So thank you both for taking the time, and we'll look forward to staying in touch as we move forward. And if there are anything that as things pop up, if there's anything that you feel as though we can do to be helpful, please, you know where to find us.
Great. Thank you so much for having us.
Great. Thank you. Okay. Yeah, Senator Lyons.
I just wanted to say thank you, and they left.
Oh.
But, you know, I think that at some point, whether we hear from Lynn Coda on the mental health issues that are in the Northwest part of the state or not, I think I may ask her to come into our committee, because there's always that dialogue about the responsibility for supporting kids. And is it, whose responsibility is it? Agency of Human Services, Agency of Education, who pays for it, all of those things. So I think, you know, that both of our committees should be hearing this information going forward. And I know there's 3 of us here, but there are 2 more that are not here. And I think we probably should expand this as much as possible.
That would be great.
Yeah, and then one other comment, you know, remember, oh no, you don't remember, you're not on, we heard on the Child Protection Oversight Committee meeting this summer that the Agency of Education only deals with curricular issues. So when there's a Kern-Hatton issue, they don't provide the rules and the guidance for oversight on some of those egregious things that happen, which is contrary to what we're listening to right now. So when you have social emotional learning as being so critical for kids, and then you say we only look at curriculum, that's a oxymoron or a paradox or something. So just an observation.
Great. Okay, Mr. Pennick, we have good to see someone here from the Northeast Kingdom. I did, for complete transparency, indicate that we are related, and glad to have you here. We're getting a little bit of an echo from your side, a little bit of some background noise.
Let me try to address that.
Okay, yeah. Sounds like he's in an airport. Patrick is 7 years my senior. He's the youngest of 9 children.
So thanks for inviting me. I'm Patrick Pennick, Pat Pennick. I'm the principal here at Hardwick Elementary. Is the echo better now? It was a
little. Maybe if you just turn it down a little bit, then
yeah, I turned off an air filtration, but I'll turn down my volume there as well.
Yeah, that's great.
Okay, great. So anyway, yeah, principal Hardwick at Hardwick Elementary, and I'll just set the context here today. Both Monday and today, I started the day and ran the day short on 16 staff. We had 16 staff out of 50, to give you the context, yesterday, and we had 16 also out today. And that's been, you know, just a huge ongoing struggle, I think, for all of us, and all businesses and organizations. But in, you know, if I look at elementary schools in particular, you know, we can't be in a position where we'll say, oh, let's just have all the kids go to the library or cafeteria and they'll kind of take care of themselves. But they need direct supervision, and they need those connections and supports from staff throughout the day. So it's definitely an ongoing struggle. But, we're managing, we're so excited. I think just having, opportunities for kids to be in person at our level is great. And our staff is, really stepping up and just putting 110% in every day. So from the committee, I don't know what you wanted me to address first. I've been enjoying the discussion so far with, the other administrators that have been here.
Yeah, I mean, one of the things I'd just be curious to know is when you have 16 staff out, what do you do? I mean, Hardwick, that general area, you're not nearly the number of people that could pull from, like a Burlington or Bennington or Rutland. So how do you fill in?
Yeah, it's it's a challenge. It's a puzzle every morning. That everyone that's available that doesn't have a direct supervision responsibility for children needs to take over classes, needs to cover duties. A lot of staff like special educators who, interventionists, myself, admin assistants, paraeducators all step in to cover classes and to cover what needs to be done. And we do have some substitutes, but not that many. We generally would have available, maybe 4 substitutes on any given day to cover, and the rest has to be covered just internally with staff that we have.
So yeah, I would say 2 things. Number one, if you want to say a few words about, on the ground response to these new changes that are coming out of the Agency of Education and Department of Health, and then spend a little time on some of what we've been talking about, some of the social, emotional health issues that you're seeing. Those 2 things would be the most helpful.
Sure, absolutely. Well, first, the new changes that were kind of previewed Friday through the media, I heard about them, and then kind of a little more information today came out. I think that something needed to give in terms of the contact tracing, as you've probably heard earlier, the constant effort that staff have been putting in weekends, evenings, trying to do contact tracing has been kind of immense. And as COVID is spreading, it's so widespread right now. We have so many cases throughout the school and throughout the district that essentially contact tracing is just kind of untenable at this point. So I think a change needed to happen. One kind of issue with the change, it's happening all at once, and we don't have all the details at this point. The AOE, I know, is struggling and trying to really do the right thing and to help schools out, but right now we know that there's going to be a shift in terms of not doing contact tracing without fully knowing all the details of how we're going to do it instead. One thing that I heard a lot earlier on how these changes are rolled out, and any feedback I could give to you for the AOE would be, as we make changes, we often do it as like a pilot initially. It might be, hey, let's try this new rolling out of not doing contact tracing and just kind of looking at it in a different way with testing for anyone that might have been in the class. Let's roll it out in a supervisory union, for a couple of weeks just to see how it seems to go and try to iron out a lot of the issues that come up. Because as you all know, the devil's in the details. Once you roll these things out, there's a lot of questions, there's a lot of uncertainties, there's a lot of things that you don't anticipate. So to roll it out on a smaller scale, even for a week, might have helped and given us a nice long list of FAQs that we could all follow, once it hits us or we need to do it. So that would be one piece. So I can't say a lot in terms of how it's going to go and how it will work, because the details are a little vague at this point. I do hope that they are ready with the number of tests that they're going to need. I just anticipate if we're going to have a COVID positive at any of our classes, the whole class will be sent home, and the unvaccinated will need to take COVID tests for multiple days. We'll send COVID tests home with them. That's going to be just a tremendous number of tests that we're going to be sending home with families. I know there's a lot of concern here among staff. We do worry that with some families whether they will follow through on the testing at home. Families are struggling with having to go to work and with childcare, and we feel like there may be some folks that would be concerned. Last thing they want to have happen is their child to test positive, because then they can't go to work, and all sorts of other financial implications will roll out from that. So we are putting it on the families and trusting the families to follow through with testing and let us know if their child does test positive. So I guess a lot remains to be seen. We'll see what happens when it rolls out, but a big piece would be making sure that we have all the materials available to carry it out.
Questions before we move into the social and emotional piece? So so right now, so these would go home to families. They would have, and it's completely on the honor system. I mean, you're basically, as far as you know, it's a check off. It's, hey, we did the test, and this is.
That's right. As far as I understand, if we had, say, a second grade classroom and we had a positive COVID in the second grade classroom, that any of the children that are not fully vaccinated would be sent home with, I believe it's 5 days worth of the COVID tests that they could do at home, and then parents would do it, and if they're negative, they'd be able to come to school each day. So it's kind of like our current Test to Save program, but it's being done primarily at home. The vaccinated kids would be able to return to school without anything at that point, unless they became symptomatic. And then if they become symptomatic, of course, they would have to go home and follow other protocols. And the other concern is that we see this current variant is spreading pretty rapidly through vaccinated folks as well as unvaccinated. So we'll have to be super diligent on the symptoms. If folks show any symptoms, we'll have to make sure that we get them out of school quickly.
What percentage in that district are vaccinated? If you look at that whole district, any idea?
Yeah, I don't have a number. I'm sure it's higher at the high school level with the older kids. The younger kids, came on a little late in terms of getting vaccinations. So I don't have a number right now that I could give you. So and it's also the record keeping with the nurses. The nurses, I heard earlier some statements from around nurses and the stress that is on school nurses right now can't be understated. We have just an awesome school nurse that we have here, and she is just, is 24/7. And it's, I think we all like working hard, and we think it's a great cause, but it becomes when you're just working and feel like you're treading water. And I think the nurses, they're not doing their usual, they went into the field in order to work with kids and take care of kids and support kids emotionally and physically here at school. But now they're spending a lot of time really having to tell families that their child, is going to be out for 5 days, 10 days, or whatever it is. And it's the relation. I think a big thing with COVID with schools is the damage to relationships that we have between schools, school personnel and families, because we're the ones that are kind of the front line, the people that they run into that have to give them the bad news and have to tell them their kids can't come to school. And then they have to scramble to find childcare or not go to work. And it's stressful. And of course, people are in an emotional state at that point. And so at least here, I know throughout the district and the area, our school nurses are really getting a lot of tough phone calls from parents, and it can take a lot of their positive energy away and demoralizing for them. So I think supporting them is a big goal that we have, and getting more folks trained and more people in the schools able to do the work and to support the school nurses. And in that line, it's not a financial issue right now. This is we think as school leaders, like, wow, this is great. We have plenty of money to hire this extra support, but in areas, at least up here in Hardwick, we just don't have the people. We don't have the trained applicants. So with all of our positions, from school nursing to teaching to paraeducators, special educators, we really are unable to fill positions because we just do not have applicants for these positions.
Yeah, I mean, and it's consistent, with what we've heard, but I suspect in the kingdom and in other rural parts of the state, it's even worse. So in terms of students' emotional and social health, I suspect it's consistent with what we've heard from other people that this is going to be a long-term issue. This is something that is not going to be, rectified, brought up to speed with, a year after the pandemic.
Absolutely. I mean, we were struggling pre-COVID. The opioid epidemic was going strong, in many of our areas, including our community, before COVID, and it's still there. I mean, it is clearly not going away. If you look at the opioid overdoses that have occurred in the state over the past year, I believe they've gone up from previous years, and we see families that are still impacted and continue to be impacted by that, and of course the kids as well. And so we had that entering the pandemic, and with the pandemic, it is really, just as you've probably heard over and over again, has certainly added to that stress on families and kind of deteriorated the mental health of both kids and caregivers. So for us, we have a pretty strong relationship with our mental health agency, Lamoille County Mental Health. is our health agency that we work with, and having access to the health agency where they have the trained personnel, and they're just such great resources. So rather than the school and SU to have to go out and create our own kind of mental health system, to have folks that are already there and are experts in this and have a system to come partner with us has been very helpful. But I know they also are struggling to find staffing. For example, here at Hardwick, we have our guidance counselor, school guidance counselor that is locally funded, and we also have a school clinician that we contract out with Lamoille County Mental Health that's been working with us, and we've been trying to find an additional clinician to help because we have such a high caseload of students that need the supports. But Lamoille County's been unable to hire someone. They just don't have the qualified applicants either for that. So for me, I would like to see that those strong relationships with our mental health agencies to help support a lot of the needs that we have here at school, because as we know, it's not just the kids at school that have struggles. It really stems from the family and within the community. So being partnered with the health agencies allows, and they have a lot of resources. They could reach out to families, provide counseling for the adults, other kind of community resources that they can give them access to that we would struggle to be able to do that. So that's the direction that we're heading in here.
Great, very helpful. Committee questions, comments. So I think it's good we don't always hear from your neck of the woods. Appreciate you checking in. And as we move forward with all this stuff, please, as I've said to everybody else, let us know how we can be helpful. If there are things that your district needs, certainly the legislature wants to hear if there are things that we can do at this point. I would also say we're going to jump on with the Secretary of Education. You probably also have to get going, but feel free to stick around and listen to his comments as well. Anything else, Pat, closing comments that you wanted to add?
No, I think we're all struggling from the AOE on down to kind of do what's right for kids, and we're doing the best we can. And earlier there was some talk of a lot of the positions that we have now to support mental health are grant funded, and so just kind of having an eye to the future in terms of what's going to happen when some of those grant fundings and those ESSER funds dry up. So yeah, it's not going to go away, and we'll certainly need it for multiple years.
Senator Hooker, did you want to add something about that?
Yeah, please. Just for a second, Mr. Pennick, could you address the idea of remote learning and whether or not those classes should be counted as learning days?
Yeah, thanks. I think remote learning is something. It doesn't, it certainly doesn't equal in-person learning. But I think if we do shift to remote, having the option to do remote learning with kids, or do need to close school because of COVID outbreaks, having the option to do remote learning at least gives kids a contact there for the day. And without being able to use those or have them count as learning days, I think it was raised earlier that it would put us in quite a bind because our teacher contracts are all for a certain number of days. And so it's kind of like right now, if I have to close school or close classes and we can't do remote learning, that means the kids will get nothing. So at least if we knew that we could do remote learning and it would count as a school day, we would at least get something to the kids.
What percentage do you have a sense of the students in your school that do not have adequate internet? In other words, it's they might have something, but it's not, again, what it should be.
Yeah, and I think I don't have an exact number, but it's a pretty small number. I would say 5% or so. I think most folks do have some level of access that they could do remote learning with.
And then what does that 5% end up doing?
Well, we also would have to provide in those circumstances paper packets and other types of things for kids that families can pick up.
Okay.
And just one other question.
Yeah, please, Senator Hooker.
How big is your school? What's the population of?
Yeah, we have 220 children, pre-K through 6th grade.
Thank you.
Okay, thank you.
Hey, thank you.
Really appreciate it. Committee, so let's take a break until Secretary of Education comes at 3:30.